I'm James King. I'm one of the specialist small animal surgeons and I'm based at the Carrara Hospital for Veterinary Specialist Services. So today I'm going to be giving you a bit of a rundown of what's involved when your dog's actually referred to us for arthroscopy. So the process involved is your family veterinarian will refer you to Veterinary Specialist Services for arthroscopy, but this actually starts with a 1-hour consultation with one of the specialist surgeons, and we will actually be able to go through all these procedures with you also. The surgery itself will almost always happen on a different day, but that will be all prepared with you at the time of the consultation. So on that separate day, when you present to Veterinary Specialist Services early in the morning, usually between 7:30 and 8:30 in the morning, one of our nurses will come to admit your animal, and we'll also go through a few standard questions just to go through with has your dog been fasted in the morning and what sort of medications you're on, and any other sort of special requirements that your patient might need. And this is just to double check everything so nothing's missed at the time they're in hospital. So talking about arthroscopy in particular now, it is actually a procedure which involves a fibre optic camera which gets inserted inside a joint and for two main purposes. So both diagnostic evaluation, but then also we can therapeutically treat your dog's condition at the same time. The benefits are that it involves very small incisions into the joint, so we do believe this reduces morbidity quite significantly to your animal. Okay, but also it allows a really superior diagnostic evaluation of what's going on inside the joint compared to if we were to open and look inside with the naked eye. The second benefit is that we can also therapeutically treat some of your dog's conditions at the same time through another separate little incision, again with the guidance of the camera to guide everything that's happening inside the joint. The three main examples of where we use arthroscopy in particular will be in your dog's or cat's stifle or the knee joint, or the elbows and the shoulders. So some real probably particular examples where we use this most commonly are within the stifle is to assess the meniscus during, and most commonly, a cranial cruciate ligament rupture. And then also at the same time as that is to treat any sort of meniscal tears, which can be what we call a partial meniscectomy, again through a separate small incision. Two other examples are into the shoulder and to the elbow. Elbow most commonly is where we talk about it from a collective term being elbow dysplasia, where again we can diagnose, and not only for the diagnosis of what's happening inside the joint, but also gives us a good idea prognostically to how that joint's likely to behave in the future, also to give you as much information as possible. Generally, the length of hospitalisation can vary just depending on what sort of other procedures are involved on the day and whether we believe that your animal will require or benefit from prolonged analgesia while in hospital, as well as monitoring and ensuring that they are safe to go home on that day. The outcomes you can expect after arthroscopy will highly vary depending on not only which joint we're actually performing surgery on, but also the underlying condition, because all of these have vastly different prognoses and also vastly different post-operative protocols as well when you go home. If you have any further questions about the benefits or even the indications for arthroscopic surgery at Veterinary Specialist Services, please never hesitate to contact one of our specialist surgeons, and we're more than happy to go through more details with you.